Hello and welcome to another video in Foundations in Maternal and Newborn Health. In today's video, we're going to be covering the hormonal regulation of labor. The hormonal regulation of labor. So in the previous endocrinology videos, we've gone over some of the different hormones that are involved in maintaining homeostasis. In today's video, we're going to be talking about how some of these hormones play a role in labor and delivery. So the first hormone you might think of when you think of labor is oxytocin. Oxytocin. And oxytocin causes uterine contractions. So your brain releases oxytocin from your pituitary gland into the blood, and then the oxytocin travels down your body through your blood vessels. So once oxytocin reaches the uterus, it'll get into the muscle of the uterus, or the myometrium of the uterus, and it'll tell the muscles of the uterus to contract. And of course, if there's a baby inside the uterus, this will cause the baby to be slowly pushed out. So the other hormone that we've actually talked about just briefly is prostaglandin E1. Prostaglandin E1. And this causes cervical ripening, which is just your body actually dissolving or breaking away your cervix. So this is cervical ripening, and your cervix again holds the baby in, and so prostaglandin E1 breaks down that cervix to allow the baby to come out. Prostaglandin also causes some contractions as well. So it will also be in the myometrium causing uterine contractions as well. So a new hormone that we haven't talked about before is beta endorphins. And this is also produced by the pituitary gland, and it's your body's natural painkillers. So your body, when it goes into labor, it knows it's going to be a very painful process, and so your brain releases these beta endorphins to try to protect yourself a little bit. So the beta endorphins will act all over your body. It might come into your uterus. It'll kind of go everywhere. It'll go back to your brain as well, to protect yourself a little bit from some of the pain that's coming. The other hormone, which we've talked about before, is prolactin. So during labor, your body starts to produce more prolactin. And again, we've talked about how this prolactin travels to the breast to tell the mammary glands within the breast to start producing breast milk. Prolactin and oxytocin are also both involved in helping with the feeling of attachment to the baby. So when the mother's producing oxytocin and prolactin during labor, once the baby comes out, these hormones tell the brain to be attached to this newborn baby, to love and nurture this baby. So these hormones also tell the brain to take care of this new baby. So there are other hormones that are involved in labor. The adrenal glands produce epinephrine, which is helpful during labor as well. But we're going to focus on these ones here because they're arguably the most critical. So the next thing that I wanted to cover in this video is how we can use these pathways in the clinic. And there are certain drugs that we can give that can either copy these pathways or inhibit them or stop these pathways from happening, depending on what we want to do. So a good example of this is Pitocin. And we've talked about Pitocin briefly in another video, but Pitocin is really the same thing as oxytocin. And so your body sees Pitocin as oxytocin. So if you give Pitocin to a laboring woman, the brain and the body will see Pitocin and oxytocin as the same molecule. So Pitocin will also travel from wherever you administered it to the uterus, to the myometrium, and cause uterine contractions as well. And so we can use Pitocin to either augment or start labor because your body sees it as oxytocin. So another example of this is misoprostol. And similar to how your body sees Pitocin and oxytocin as the same molecule, your body sees misoprostol and prostaglandin E1 as the same molecule. So misoprostol will also cause cervical ripening, and it'll also cause some contractions as well. So again, your body sees misoprostol as prostaglandin E1. And the same can be said for beta endorphins. We can use opioids, and your body sees opioids as the same as beta endorphins. So beta endorphins take away any pain, they make you feel very good, and that's why opioids are addictive. They make you feel really good, they take away all of your pain, and so your body sees opioids and beta endorphins as the same thing. Domperidone is slightly different from these other drugs, but domperidone tells your body to make more prolactin. So your body doesn't see domperidone as prolactin, but domperidone tells your body to make more prolactin, which you can use if you have a patient who isn't producing enough breast milk. You can administer domperidone to tell the patient's body to make more prolactin, which will in turn tell their body to make more breast milk. So these are some examples of how we can use drugs to take advantage or to take over a patient's natural hormones. So the last thing that I wanted to touch on was a class of drugs called tocolytics. And tocolytics are drugs that slow or stop labor. And so you can imagine this is very useful for preterm labor. So if a woman goes into preterm labor, you can give tocolytics to slow down her labor and to either, move her to a safer place or fly her to a bigger hospital, for example, or to give other drugs to help the baby survive the labor. And we can use our knowledge of these pathways to understand how these tocolytics work. One of the first line tocolytics is nifedipine. And nifedipine works by stopping uterine muscle contractions. So it stops these uterine muscle contractions from working. Stops muscle contractions. And so in a way, this kind of stops oxytocin from working on the uterus. It stops oxytocin from allowing the muscles to contract. Another common tocolytic is indomethacin. And indomethacin works by stopping the production of prostaglandin E1. So it tells your body, don't make any prostaglandin E1. And of course, this will stop the cervical ripening from happening and keep the cervix in place. Again, keeping the baby inside the uterus. So nifedipine and indomethacin are both examples of tocolytics. So I know that this was a lot of information. We went over a lot of different drug names and hormone names in this video. But I think the biggest takeaway here is that when we use drugs in the clinic, even though they have these really scary names like indomethacin or nifedipine, they're really just taking advantage of these pathways that we have in the body naturally. And so we can avoid taking these medications if a woman is producing her own oxytocin or her own prolactin. But if this patient needs a little bit of help, either needs a little bit of augmentation or a little bit of domperidone to produce more breast milk, these are how these drugs work. And so when you hear of these drugs in the clinic, these are some of the ways in which they work to produce the effect that we want.